Welcome to Breast Cancer Breakthroughs. The 2025 American Society of Clinical Oncology meeting, or ASCO, took place in June. During this event, the latest practice-changing advances in breast cancer treatment were discussed among more than 40,000 oncologists, scientists, and patient advocates. This was a big year for breast cancer news, with several Phase 3 trial results being unveiled for the first time. In this episode of Breast Cancer Breakthroughs, we'll hear from former Komen Scholar Dr. Hershman about the biggest news in early breast cancer announced at the meeting. We'll also discuss some of the big takeaways for metastatic breast cancer. Advances in early breast cancer encompassed many aspects of care, from new treatments to managing side effects. When we asked Dr. Hershman about her take on the top advances in early breast cancer, she told us about a study in colon cancer that has big implications for breast cancer.
One thing I think that everybody has been really interested in, and I have to say it's a colon cancer presentation, but it also reflects on early stage breast cancer because for breast cancer, colon cancer, and several other cancers, there's been a long-standing interest in terms of the benefits of exercise and diet. And one of the challenges with all of these research studies is that we've always looked at intermediate endpoints. Does it affect quality of life? Does it change the tissue biology? Does it change our blood biomarkers, meaning it changes things that are associated with an increased risk of recurrence, like the amount of insulin in your blood or your weight or your glucose levels or other factors, even leptin. But there is a large trial that was presented in colon cancer that has real importance for breast cancer. And what they did was they looked at patients with stage 3 colon cancer and randomized them to physical activity with a personal trainer for 3 years versus standard of care. And people could do whatever exercise they wanted to as long as they were exercising. And interestingly, they found after many, many years of follow-up that the patients in the physical activity arm had a reduced risk of recurrence and improved overall survival. Now, that's really practice changing for colon cancer, but it gives us a lot of hope for the many ongoing trials in breast cancer, such as Be Well, which tested a dietary and exercise intervention in breast cancer that will hopefully have answers soon. And so I think that it's really promising for the whole field of lifestyle modification and cancer and how we can improve outcomes in the long term. So it's important in breast cancer to pay attention to what's going on in other cancers as well.
To learn more about the Be Well trial, check out our video linked below. Ensuring that no one gets too much or too little treatment is a major focus of early breast cancer research. Dr. Hershman discussed some studies that focused on right-sizing treatment for people with early breast cancer to maximize benefit and minimize toxicity that, to her, were among the biggest news at ASCO.
There were a lot of studies looking at carboplatin and whether or not you really need carboplatin in some of the treatments we give neoadjuvantly, suggesting, like, for example, we give carboplatin for in some of the regimens for HER2-positive breast cancer, and do we really need it? And there were several studies suggesting that there's really not a huge benefit to giving carboplatin, and maybe we can remove that and reduce the toxicity, sort of in that same theme of doing less. Less is sometimes more. There was also some interesting studies on dosing, and we now know that for women that have high risk endocrine sensitive cancers, we've sort of incorporated CDK4/6 inhibitors into that adjuvant therapy regimen, and but they can be hard to tolerate. And so there was a clinical trial out of Dana-Farber looking at ramping up dosing of abemaciclib, and showing that if you start at a lower dose and ramp up slowly, more people tolerate it and less people discontinue it overall. And so sometimes it's not just knowing what to give, but how to give it so that you can improve the likelihood that patients will stay on their medications. And this folds into a large trial that ASCO is doing that I'm part of a PCORI funded dose study that's looking at dosing for both abemaciclib and ribociclib, trying to find how to give these medicines in the right dosing, because that's been a long-standing interest from our patients.
We also heard the first results from the Komen-supported COMPASS HER2 PCR study, another clinical trial aiming to de-escalate chemotherapy for people with HER2-positive breast cancer. Dr. Hershman explained what we learned from the study.
I think we're always in oncology and the treatment of early stage breast cancer trying to figure out how to get the maximum benefit with the least toxicity. And every trial that's done leads to a new idea: who needs more and who needs less. And the Compass HER2 PCR study was really evolved from the data that we had from the APT trial in the adjuvant setting, that was suggesting that a large number of women that just got adjuvant Herceptin and Taxol did really, really well for a really long time. And so the question was, the standard of care for women getting neoadjuvant treatment was to give, 18 weeks or longer of adjuvant, neoadjuvant therapy to help guide therapy, because we knew that if you had residual cancer left over, maybe you would benefit from more treatment. And if you had a PCR, maybe you didn't need more treatment. So the question was, can you limit the amount of treatment you get before surgery? But what they looked at was just giving 12 weeks of therapy. And what the PCR rate was, just with a much shorter amount of chemotherapy and not giving carboplatin. So just a taxane, Herceptin, and Perjeta. And you can give it various different ways depending on the patient and the provider, Taxol or Taxotere weekly or every 3 weeks, but for 3 months. And, they met their criteria in terms of finding a pretty high PCR rate. I think it was maybe 60%. But importantly, patients with ERPR negative cancers had a substantially higher PCR rate, closer to 70%. And what was really interesting is that they could look at a new biomarker panel in the tissue to also help predict who is more or less likely to have a PCR. And so suggesting that, if you're somebody that falls into a high response rate, that maybe you can get away with a lot less chemotherapy and do very well. And more results will follow, but it's sort of part of the pathway of doing less, because we know that less treatment means less toxicity.
To learn more about the COMPASS HER2 PCR trial, check out our video linked below. The Phase 3 OASIS 4 trial tested a new option for treating hot flashes in women taking hormone therapy for breast cancer. Dr. Hershman explained the significance of these results for patients.
Women that are treated with breast cancer often really suffer from a lot of the side effects, the endocrine side effects of the therapy. Many women who are premenopausal during their treatment go into menopause as a result of either the chemotherapy, or they have ovarian function suppression as part of their treatment. And postmenopausal women are getting that have estrogen receptor positive cancers are getting treatments that suppress their estrogen level. And one of the main side effects that women experience from all of this is hot flashes. And many, many women suffer from hot flashes. It can affect their quality of life. Some women have them, really throughout the day, it disrupts their sleep. As sleep is disrupted, it affects their mood, and so there are lots of downstream consequences. And we know that women stop taking their medications prematurely because of many of these and other side effects. So while there are some medications that improve hot flashes, they all have their own host of side effects. The most promising medications to date have been low doses of antidepressant medications, but they can cause side effects with regard to nausea and also sexual dysfunction and weight gain and all sorts of problems. So the OASIS trial tested a new class of medications that affect neurokinase transmitters in the brain and in the gut. And what the study showed was a dramatic reduction in hot flashes in women that got the agent and compared to those that got a placebo. And they did a crossover design so that if you weren't in the initial group that got the agent, you crossed over to getting the agent. And again, there was a prolonged reduction of hot flashes that persisted up to a year after starting the treatment. And the treatment's relatively well tolerated, or at least by report, it was relatively well tolerated. There's a similar class of medications that's FDA approved in the US. It's called Veozah, and it hasn't been studied in breast cancer, but it's a very similar, not identical mechanism, but very similar mechanism. But I think that there's probably other drugs also on the horizon. And so really showing promise for new ways of managing side effects that can hopefully help keep people stay on their medications for longer and improve their quality of life.
Overall, Dr. Hershman was excited about the progress happening for people with early stage breast cancer.
I mean, I think, research is our way forward. It's our path forward, and research is iterative. So sometimes it's not the be all and end all of the study results, but it's this incremental improvement of knowledge that perpetually helps us give better treatments, less toxic treatments, more personalized treatments, and better treatments that control the side effects of what we're giving. And so it's exciting to hear things in progress, but most importantly, I think it stimulates a lot of new ideas for future research as well.
There was a lot of big news announced for metastatic breast cancer at ASCO as well. We heard several phase 3 trials for metastatic breast cancer, and all had positive results. In estrogen receptor positive metastatic breast cancer, we heard the results from the VERITAC-2 trial, which tested a new oral hormone therapy medication called vepdegestrant for those with ESR1 mutations. To read more about the VERITAC-2 trial, check out our blog linked below. Another big trial in the estrogen receptor positive metastatic breast cancer space was the SERENA-6 trial. This trial found that switching to a new oral SERD called camizestrant when an ESR1 mutation is found in a person's circulating tumor DNA, or ctDNA, this drug can delay cancer progression better than the current standard of care. Be on the lookout for September's episode of Breast Cancer Breakthroughs when we break down this trial and more of what's on the horizon for ctDNA guiding breast cancer care. Trials in HER2-positive and triple-negative breast cancer challenged the current first-line standard of care, or the treatment someone receives when they are first diagnosed with metastatic breast cancer. In HER2-positive breast cancer, the DESTINY-Breast09 trial found that combining the antibody-drug conjugate trastuzumab deruxtecan, or Enhertu, with pertuzumab delayed cancer progression compared to the current standard of care that has been in place since 2012. In triple-negative breast cancer, the ASCENT-04 trial found that the antibody-drug conjugate sacituzumab govitecan delayed cancer progression better than chemotherapy when combined with the immune checkpoint inhibitor pembrolizumab. Check out the last episode of Breast Cancer Breakthroughs to learn more about how combining antibody drug conjugates and immunotherapy is transforming treatment for triple-negative breast cancer. You can dive deeper into all of these trials and their implications for patients in our latest MBC Impact Series event below. Our MBC Impact Series provides people living with metastatic breast cancer a space to gather information related to MBC, ask questions to experts, and connect with others living with MBC. Our homepage is linked below for more info. Check out this clip from the ASCO event to hear what moderator and Komen staff member Olivia Anthony and patient advocate Janice Cowden had to say about the metastatic breast cancer highlights from this year's meeting.
I think it was a very exciting ASCO. Like I said, I was really excited to see how we saw all these big talks across all different types of breast cancer. So definitely a lot to look forward to, especially as we learn more about some of these trials that were presented and we learn more information. But yeah, really excited to see where it's all going.
And I'll just follow that up with, I was also excited. I'm really hopeful that by the time we get to the San Antonio Breast Cancer Symposium, that we have made some progress on getting some of these phase 3 drugs moving forward to FDA approval. But also one of the most exciting things too is when you attend one of these conferences and you see not only what's being presented as a phase 1 through 3 trial, but you also often see what's in the pipeline, and especially for hormone receptor positive metastatic breast cancer, when you look at what's in the pipeline, what's to come in the next several years, there's an incredible number of not only new drugs, but new classes of drugs that are being tested and new combinations. So I think it's very exciting. My biggest hope is that by San Antonio this year, because there hasn't been a lot on metastatic triple negative over the last several years, especially since immunotherapy was FDA approved. So I'm very hopeful that we will get some movement forward in metastatic TNBC in the near future.
Thank you all so much for watching. We hope that hearing about the latest advances in breast cancer research and treatment leaves you hopeful and empowers you to take charge of your breast health. Here at Komen, we are committed to bringing you evidence-based information as you navigate your journey with breast cancer. Don't forget to sign up for reminders for breast cancer breakthroughs. We've linked the homepage below. And finally, if you've enjoyed today's episode, please take 2 minutes to fill out our short survey, which you can find linked in the description below.